Hi, I'm Donna Pelletier, and I am a faculty at the University of New Hampshire in Durham, New Hampshire. My role currently is as director of the DNP program. Many nurse practitioner programs have challenges finding high-quality clinical placements. We have clinical sites that give them sometimes limited exposure to the common problems they'll see in primary care for our nurse practitioner students in family practice. We have some students who get very high quality sites and other students that have a limited exposure, and that puts them at a disadvantage. Also, formation is a very important issue in nursing education. We are developing RNs to become nurse practitioners, and in that process, we wanted to enhance their role development as well as expand their critical thinking. Aquifer was a solution to all of the challenges that I mentioned. And by completing the cases that we subscribe to, they have a level playing field as they go into their clinical rotations and have some experience and some illness scripts that they've developed to be able to tackle the patient problems that they see in the practice setting. So some of the other things that are terrific about these cases are that they do ask the student to reflect on their learning. They write summary statements, and that allows them to compare notes with classmates. We talk about those in the classroom when we are going over similar cases. The cases, by allowing the student to come up with their own differential diagnosis and trying to prioritize which one would be their working diagnosis, has been a real help for us in our teaching diagnostic reasoning. Another win-win for us is that the students in our flipped classroom can complete these cases on their own time. And I do believe that the self-study model has really worked for our students. They can take notes, they can spend as much time as they want in the cases, and they come in with a pretty good understanding of that particular problem. In the classroom, we then augment that with giving them different case scenarios with different nuances for the same type of problems, and it really does deepen their learning. We use the Aquifer cases for remediation as well. When we go out to clinical site visits and students haven't performed to meet our expectations, we have them repeat the cases, and they meet with us with the summary statements, and we can then have a rich discussion around the nuances that they may have missed in the clinical setting and how to mitigate that for the future. We feel that the Aquifer cases are of such high quality. We have confidence that you're giving the students the latest evidence-based guidelines that they can refer to, demonstrations that are accurate, and they have to sometimes unlearn bad behaviors that they've had. And so there's a lot of rich learning that goes on with the additional content that you have in the cases. Our students overwhelmingly report how much value they find in completing these cases. They report that it's time well spent, and they frequently comment it is the best learning resource we have in our program.